We want to be careful with our use of Tylenol during fevers. As an analgesic, Tylenol is typically used in kids for aches and pains due to cold and flu, menstrual cramps, headaches, sore throat, things of that nature. If you're reaching for Tylenol every time your child feels unwell, you might want to think twice. Tylenol is one of the most commonly used medications, but its risks, especially in children, are often overlooked. In this video, I'll go over what some of those concerns are, as well as some safer alternatives. As a naturopathic doctor and a mother, this topic comes up a lot with parents. Now, many of you will find this information new, as Tylenol is typically seen as a benign over-the-counter medicine. By the end of the video, you'll have a better understanding of what it actually is and what it does to the body. So what is Tylenol and how does it work? So Tylenol is the brand name for a drug called acetaminophen, which is also called paracetamol. And this is primarily processed by the liver and detoxed by the liver. Now, when the liver tries to detox Tylenol from the body, it produces a toxic metabolite with a very long name, which we're just going to call NAPQI for now, NAPQI. And what NAPQI does is that it can cause a lot of harm to our liver and kidney cells especially. And to mitigate, this toxin is neutralized by our master antioxidant, which is called glutathione. So essentially, Tylenol causes depletion of glutathione as it tries to neutralize this NAPQI toxin. Overuse or frequent use of acetaminophen can deplete glutathione, which not only leaves our cells then more susceptible to DNA damage because glutathione is not there to take care of the free radicals, but it also leaves us more susceptible to the effects of NAPQI as a toxic metabolite in our body because glutathione is then used up and can leave NAPQI unchecked to wreak havoc on the body. Now, while acetaminophen can cause liver and kidney damage, especially when you exceed the recommended amounts, in some cases, liver damage has been seen even at the recommended dosages for Tylenol. Kids are especially more susceptible because they naturally have lower glutathione levels due to their developing liver systems. Now, something interesting to note is that acetaminophen is one of the primary causes of acute liver failure in both the United States and in the UK. Now, this is far more acute liver failure from viral hepatitis, for example, in these countries. Some countries have implemented restrictions on the sale of acetaminophen or paracetamol, same thing, in their efforts to mitigate the risk associated with the harm from overuse and damage to the liver and kidneys. For example, in countries such as the UK, Ireland, and Denmark, there's restrictions on maximum pack sizes of paracetamol that can be purchased. And I think in Switzerland, you can still buy 500 milligram tablets over the counter, but you need a prescription to order the 1000 milligram tablets. However, unlike in these other countries, here in the United States, we don't have any restrictions on purchasing acetaminophen or Tylenol. And because it's sold over the counter, this makes misuse and overuse far more common. Now, again, it's important not to exceed maximum doses of acetaminophen or Tylenol use in children and adults alike. But we need to be mindful of the labels and the products we're using. Typically, when we think of Tylenol, we just think of children's Tylenol for kids, but acetaminophen is also found in products such as Dayquil or NyQuil. So if you're using these in addition to Tylenol for yourself or your kids, these amounts can easily add up and cause damage to the body. Now, two of the main reasons why acetaminophen or Tylenol is used, especially in kids, are for fevers and for pain relief. And this makes sense as Tylenol is in those drug classes of being an antipyretic, fever-reducing medicine, and an analgesic, which is a pain reliever. Now let's talk about fevers for a second. The problem with suppressing fevers with an antipyretic, a fever-reducing medicine such as Tylenol or others, is that it's going against the body's naturally wise inherent mechanism, which produced the fever in the first place for a specific reason. Now, the fever is not an illness in and of itself or a disease to be treated. It's a sign that the body is trying to overcome an underlying infection. So using Tylenol to bring the fever temperature down can be quite counterintuitive. Now, this is not to cause anyone to feel any guilt or shame. Fevers can be quite frightening for parents, especially if they don't truly understand what's going on or why it was produced by the body, what it really does for the child's body, and how to really assess for the red flag symptoms. I have a whole ebook coming out on mastering natural fever cure safely at home. So be on the lookout on my website for that in 2025. So again, as we learned about earlier, when we use Tylenol, it depletes glutathione, which is our body's master antioxidant. And this is a time where our bodies can use it the most for immune support and supporting our body's brilliant efforts to combat the underlying infection that's behind the fever. So instead of fearing fevers, we need to really understand them first better and then next support them safely. So typically what happens with acetaminophen or Tylenol use during fevers is that when we give Tylenol to a child who's feverish, that will then create a strong effect on the body to lower the temperature set point, and the number and the temperature goes down. For some parents, that seems like a very nice relief and the child may feel more comfortable in the short term, but unless the body has overcome the underlying infection and taken care of what it needs to take care of, as soon as that medication wears off, and maybe some of you parents have recognized this, the body then tries to increase the temperature again because it wants to finish the work it started. So there's this little bit of a dance going on where you give Tylenol, the fever comes down, but as soon as the medication wears off, now the fever is trying to rise again because it's trying to help heal your child's body with that fever. Essentially, this can cause fevers to burn hotter and longer as we do this dance back and forth where the body's trying to mount a nice, robust fever to take care of the underlying pathogen or infection. And in some other cases, it can make illness worse in that it suppresses the toxins from being properly taken care of, and it drives toxins deeper into the body that the body then gets overburdened by and has to deal with later on. We often don't see that connection. We tend to be happy that the fever is just finished. So we want to be careful with our use of Tylenol during fevers, knowing this information. As an analgesic, Tylenol is typically used in kids for aches and pains due to cold and flu, menstrual cramps, headaches, sore throat, things of that nature. So are there safer alternatives that exist to help my kids through fever and pain? Absolutely. And my favorite therapeutics to use are hydrotherapy, homeopathy, and herbal medicine. And of course, additionally with fever, you want to make sure that the child is very well hydrated as well. So the different methods you would use depend on what's going on with the child. For example, with fevers, something called the warming sock treatment is very helpful and effective. There are different homeopathic specific remedies that you would use depending on your child's presentation during a fever. And then there are gentle herbal medicines that you can use as tea or glycerites, which are like alcohol-free tinctures, can be supportive during a fever instead of suppressive. And for pain, depending on what the pain is, where it's located, and the age and weight of your child, you can also use herbal anti-inflammatories and herbal support. Hydrotherapy, contrast hydrotherapy, which is contrasting hot and cold water locally to the area of pain, can be very supportive in bringing blood, fresh oxygen, and nutrients to the area and clear out the wastes, which can reduce some of the painful sensations. Again, specific homeopathic remedies based on the symptom presentation of your child. Very unique, and they need to be tailored to the unique situation of your child. What about in the meantime for those who continue to use Tylenol? Is there anything we can do to support and mitigate some of the risks associated with Tylenol? So for one, in general, you can try to consume more ion-boosting foods such as broccoli, spinach, asparagus, cabbage, and so on. It's also important to make sure to avoid any dietary or environmental toxins that may be overwhelming the body. That can also use up a lot of your glutathione, making it less available to do the important work that it needs to do. It's constantly trying to put out these other fires. So this is, again, as always, bringing in the foundations of health conversation, as it is truly the foundation to so much of our health and wellness. You can also use a supplement called NAC, N-acetylcysteine. NAC is the precursor molecule in the body that then makes glutathione in our bodies, and it's very effective. It's cost effective too. It's a bit cheaper. It works very well. Fun fact, NAC, N-acetylcysteine, is what they give to patients in the hospital. They come in with suspected liver toxicity due to acetaminophen overdose. NAC is the antidote for that. Of course, it's best administered as soon as possible. Alternative Tylenol considerations, you always want to make sure to find the root cause of what's going on with pain, for example, whether it's dietary factors, stress, lifestyle, or emotional causes, which definitely affect physical health as well. not only for adults, but for children, finding these out and minimizing them or taking care of them and reduce the frequency how often we experience pain, depending on where it's coming from. And with fevers, understanding really why they're there and what's causing them go a long way for your child's overall immune development and strength. So to summarize, Tylenol isn't inherently bad, but its risks are often underestimated. By understanding these risks and how Tylenol really works in the body and learning about some safer alternatives, you can make more informed decisions for you and your family. If this content resonated with you, don't forget to subscribe for more natural and holistic health insights. I'm Dr. Jinmee Graham, and I'll see you next time.